Red Cross workers drive through the streets of Sierra Leone's capital, Freetown. Their sole task is to collect the corpses of people who have died from the Ebola virus and then to bury them. It's an important but risky job that needs to be completed as quickly as possible because corpses are highly infectious. We travel with them, but for safety's sake, we use a separate vehicle. Every day at 10 o'clock, the workers gather outside the Red Cross headquarters. It's been a regular but sad ritual for weeks. Some days they do 1 or 2 trips to collect bodies. Other days they might go out half a dozen times. Team leader Desmond Rees says he's experienced all sorts of things on the job.
The biggest challenge is when you enter into a community we do not accept that Ebola exists. It's a big challenge because sometimes they put up fights, they throw stones, they want to fight.
Their first trip takes them to a suburb of Freetown, where there are reports that an Ebola patient has just died. They never know what they're going to encounter. Just recently, local villagers killed a team of aid workers in neighboring Guinea. They thought Ebola was a myth invented by the West and murdered the aid workers in anger. The team knows something similar could easily happen in Sierra Leone. Here, too, rumors are rife when it comes to Ebola, but right now, Desmond Rees has other worries.
Yeah, this is where we should pick up a body, but we don't know the exact house. We don't have contact number for the people, so we are trying to contact their coordinator.
The team divides into groups and sets out. But no matter how many people they ask, no one in the neighborhood is willing to give them any information about an Ebola patient. Suspicion and mistrust are rife. Half an hour later, they're forced to abandon their search, leaving without the body. Things are even more difficult at their next stop. We can only film secretly here. The family is overwhelmed by the grief of losing their loved one and want to bury him themselves, ignoring the risks. Once again, the Red Cross workers are powerless. Just a few kilometers away in the center of the capital, Gunnar Urban, a German doctor, is also engaged in fighting Ebola. He's an infectious disease specialist and works for the German aid organization Cap en Amour. He says there's a desperate shortage of isolation wards across Sierra Leone where Ebola patients can be treated safely. He's overseeing the building of an Ebola ward for a children's clinic in Freetown. This first area will be for suspected Ebola cases, he says. The second one is for probable cases, and the third for confirmed cases. So here where we're standing is for people who probably have Ebola. The isolation ward is due to go into operation in just a few days' time. It's hard to believe right now, but the architect tells us the building team is determined to stick to the schedule.
Work from morning till 11, sometimes 12 in the evening. Then you break off, come back very early the next day. This is just to help my country.
Gunnar Urban explains the reason for the rush. As long as there's no isolation ward for Ebola patients, the children's clinic cannot continue to work normally. The risk of infection for staff at the clinic and for other patients is just too great if Ebola patients and those suspected of having Ebola are not treated in strict isolation. Indeed, the children's clinic is completely empty. When the first confirmed Ebola cases emerged here a few weeks ago, many of the doctors and patients simply fled. Stella is a nurse here. She says she understands the fear and found it difficult too.
I feel so sad and I'm afraid that time. When I go home, I have slight headache because of that Ebola patient. But I pray to God, nothing did not happen to me.
The dilemma is very real. If the clinic remains shut, children will die of sicknesses like malaria that could be treated. But if it opens without a functioning isolation ward, anyone at the clinic could be exposed to the risk of Ebola. Nurse Stella tells us that just sitting around is tortuous. With her words still very fresh in our minds, we meet up with Desmond Rees and his Red Cross team. They've just arrived at the city's largest Ebola isolation unit. 3 patients died here today, and their bodies need to be collected, a tricky task.
They know what they are doing. See, they are putting on 2 sets surgical gloves before the hard gloves to really protect the hand.
Across West Africa, more than 200 doctors, nurses, and helpers have contracted Ebola in recent months because of insufficient protection. These protective suits cost up to 50 euros each and can only be used once. Then they have to be disposed of. The aid workers say they're terrible to wear.
It's a challenge. We have to do it, for our country,
But it feels really hot inside.
It's really hot. It's really hot. Like I'm in hell now, It's really hot.
What follows is the most dangerous part for the workers themselves. They're going inside the isolation unit. Not having protective suits, we're unable to follow. Even if we did, we would not be able to use our cameras afterwards. It will take about half an hour for the workers to collect all 3 bodies. While waiting for their return, we witness a harrowing scene. A clearly traumatized Ebola patient breaks out of the isolation ward. Both the nurses and security forces are at a loss to know what to do. One police officer appears to panic. The fear here is huge. Nobody wants to touch the woman without protective gear for fear of contracting the virus. We wonder how the tragic scene will end.
So she has come out, and then, because of the effect of the infection.
So she doesn't know what she's doing? Or?
Yes, she doesn't know.
But I mean, it's a tough situation. How to deal with this? What's the best way?
Well, the best way is to get people to dress in PPs, go into PP geared, and then see how to handle her and then take her in.
To take her back in?
Yes.
It's more than half an hour later before the patient, now completely exhausted, is brought back to the isolation ward. It's hard to imagine what she's going through. Back at the children's clinic, Dr. Urban has just received some bad news. The Ebola isolation ward is not yet ready, but the health ministry insists the clinic must reopen tomorrow. It's a decision the doctor just cannot understand. As soon as the first patient arrives with symptoms of Ebola, we won't know what to do with him, he says. There are no hygiene standards at the moment for these suspected Ebola patients to be properly isolated. There's no way of protecting them or protecting others from them. The clinic directors do their best, running crash courses for all the staff to teach them how to use the protective suits. These health workers may soon be treating suspected Ebola patients, so they need to get it right. The instructor sees it as real progress that personal protective equipment, or PPE, is now available.
Since the beginning of this outbreak in Sierra Leone, most of the health workers have lost their lives simply because there was no proper method of putting on PPE. So that's why, in fact, we are strongly enforcing on the treatment, on the training for almost all the health workers in Sierra Leone to know how to put on the PPE.
We're very impressed by these health workers. They know full well the risk that they're taking.
I'm a Sierra Leonean. I cannot see my people dying and live. So I'm not afraid.
The next morning, crowds gather outside the clinic. Mothers come with their sick children, who've not been able to receive treatment for weeks. There are rudimentary efforts to stop the spread of infection, but it's all a bit chaotic. there are initially no nurses or doctors to check for any suspected Ebola cases. The head of the clinic is concerned.
I'm a little surprised. That just today so many people are coming. So we imagine what will happen tomorrow, the other days. Because today is the first day, they're already coming now. So it's going to be some problem.
But by the afternoon, things have become a little more organized. Nurses are posted at the entrance to examine every patient who arrives. So far, there has been no one with clear Ebola symptoms. But the sense of fear amongst staff is palpable. Fear that one of the patients could have Ebola and the virus could then spread through the clinic. For the Red Cross team, it's also the end of another long, hard day. They collected 4 corpses today. Now there's just one more task to take care of, the burial. Desmond Rees emphasizes repeatedly that it's important to all of them that the Ebola victims receive a decent burial.
We just don't go and throw them into the grave like that. We give them their last respect and bury them with dignity.
It's been 10 months since West Africa registered its first Ebola victim. It's hard for us to even imagine what the Red Cross workers here in Sierra Leone have been through since then. The strength and the courage that are required to do their job day in, day out. We were also impressed by the dedication of health workers from abroad. They all know they're risking their lives in the fight to prevent Ebola from spreading further and potentially wiping out the country's population.